So we haven't covered yet replication of viruses. Is that correct? Class representative. Hari note nabahaye tutara covering. Did I share this replication of viruses before we go through this, or did we go through this? Plus, abantu batendinga. Brian, did we cover replication of viruses? Brian Ishema. Can you hear me, please? Can we start?
Yes, we can.
Yeah, Shema Prince, or any other who attended the previous lecture of virology. Can you confirm we haven't yet covered replication of viruses?
Yes, we did cover the replication of viruses.
Guillaume, can you tell us? Guillaume.
Yes.
Did we cover replication of viruses or not? What? No? Okay, so let's start with how do viruses replicate? How do viruses increase in numbers in the cell? So from this, you will learn list different steps of viral replication, know the difference between DNA, RNA replication, viruses, and identify some common enzyme critical for viral replication. So we have seen that viruses are very small. If you can compare to a bacterium, you can see a bacterium as this, while a cell animal is as huge as this. So the viruses are always very teeny compared to the bacterium, but also to the animal cell. So this is the comparison. I think you have seen this image earlier, and but they can be comparable to bacterial components like ribosomes. Some viruses are just close to the ribosome size of bacteria, and they are very teeny, like polioviruses, this bacteriophage, which seem, and some are very teeny but long. This is the largest viruses, the smallpox viruses, and only measure 200 nanometer or 300 nanometer. So by comparison to a bacterium, E. coli bacterium, you can see that viruses are very teeny, very small. And as we said, viruses does not have organelle like ribosome, like mitochondria. They don't have all necessary organelle to allow them living independently. So they have to be in the organism to be able to replicate, to be able to exert some of life function. So as viral structure, we have, I think you have gone through this, you have seen this. We have the genetic material inside always, and there is the outside, what we call capsid, which is made of capsomeres. And this is for all viruses. We have the capsid, which is made of capsomere, and there is nucleic acid in protected by this shell, this capsid shell. Sometimes there is a glyco or the lipid membrane outside, which that we say it's the envelope, and this envelope allows this bacteria to interact with the host cell, and in absence of this envelope, the bacteria will not be able to infect the host cell. So as you see, even on this, we have this outer layer, which is envelope, and you have the capsid with nucleic acid in. We have the cell. So this is the graphical representation, and this is the photography, the electron microscopy photography, adenovirus, tobacco mosaic virus, influenza virus, which is enveloped like this, and this T4 bacteriophage. So we have families of viruses, and we go through this individually virus, how it replicates, the genetic material of and representative genera which cause disease. So we go through this as individual virus. So as major steps for replication, there are six actually, 7 if you consider release. One is recognition of the target cell. So the virus have to really recognize the target cell, attach to the target cell, penetrate to the target, to the cell, the host cell, and coating. So it have to be able to release the genetic material, the shell or the capsid have to get off, and it have to synthesize from nucleic acid material. It have to do synthesis of macromolecules. There is messenger RNA synthesis, and there is a late Sorry, this is the updated slide. The major steps in viral replication are the same for all viruses. And as we said, there is 7 steps. We go step by step, but first, the viruses have to recognize the target cell. It have to attach on the target cell and have to penetrate in the target cell. It have to remove its coating, the the capsid. It have to remove the capsid and release the nucleic acid in the host cell. Then once the nucleic acid are released, then from the template, the nucleic digested, then release the nucleic acid. And this is what we generate new viruses from this cell. So once uncoating means removing the capsid is done, then the viruses or the nucleic acid we enter the phase of macromolecule synthesis. And the synthesis concern the protein. There is R protein, and the R protein basically are enzymes or other protein which are needed to replicate this virus. Then there is also late protein, which are mostly the structure protein, which are the capsomeres component of the protein, and other protein required for the viruses to make assembly. Then there is post translation modification that shape each protein in the form of the virus needs. Then there is replication. Replication is increasing the number of this nucleic acid in many nucleic acid to allow each viruses synthesized to have its own nucleic acid. Then after replication, there is assembly. Assembly means each component which was synthesized aside, we get together, and getting together, we also incorporate the nucleic acid, and then the virus will be mature and will be ready to exit from the cell. If this virus is enveloped, as it is the case of this one, we have this envelope, we have the capsid, but we also have this envelope. Some of the component of the envelope will come outside the cell. Nkuko mubibona hano hari glycoproteins which will be part of the envelope, the virus envelope. We just come to the outside of lipid membrane of the host cell, and when a virus is or the virus have completed the assembly, it will just come out by budding, like excreting. The cell will remain intact, but generating more viruses, like you can see here. It will be like a manufacturer or the industry of viruses continuously. It will keep releasing the viruses. And this is non-lytic replication, or the envelopes. For lytic, this cell or the virus does not have the ability to bud or to get out. The membrane is not there to fuse with the membrane of cell. So the viruses will replicate and we completely fill, or we completely interfere with the living function, the host function, and then the cell will die, because once there is interference with the cell function, then the cell will die by death, then they will be released. Otherwise, they can't be excreted as does the enveloped viruses. Any question? Any question with this? So viruses have specifically shaped attachment protein. Each virus infects only certain type of cells. Why? Because there is always receptor of this virus on this cell. So without this receptor, the virus cannot be able to get in the cell Most virus, of course, are species specific, like smallpox is for human, polio, same, measles affect only human. Some other viruses are just can infect many other hosts, like West Nile virus, which can also infect mosquitoes, bats, human hosts, and other hosts. And this depends on how these viruses get in the host cell. Which receptor does it use? If that receptor is across different species, then the virus will be able to infect all those species. Otherwise, it can only infect a specific cell or a specific host. Some viruses are even very specific. They affect cell type specific. So they can only affect some specific cell in the host. Example, polio, which infects the intestine mucus cells and nervous cell, only, nothing else. Some other viruses can infect all type of cells. So the viral replication can be separated into several phases. There is R phases, that is mostly recognition of the host cell, that is attachment to the cell, the penetration and uncoating to get release, deliver genome to the host cell. Some viruses will replicate in nucleus, and that is mostly the DNA viruses. Some others will just remain in cytoplasm and replicate over there. Then there's late phase, which is genome replication, viral macromolecule synthesis, and assembly and release. So we can differentiate these two phases. The first phase, which leads to the release, to deliver of the genome. Then the late phase, which leads to the exit or release of newly synthesized or produced viruses. In summary, we have the phase one, where we have the attachment, there is recognition and attachment. Let's say this T4 phase, which affects E. coli. It's still fiber to find the specific receptor site on the outer surface of the bacteria. And after attaching to the specific receptor, the phage DNA and degradation of host DNA, the shelf of the tail contract, injecting the phage DNA into the cell and leaving an empty capsid outside. The cell's DNA is hydrolyzed. Normally, this is phage. Normally, for animal, the capsid does not stay outside. It gets in with it gets in with the capsid. So the virus gets in, as it have to do by either endocytosis that we see, or by fission. So for these viruses, it have this ability of ejecting the nucleic acid inside the bacteria. And after injecting the nucleic acid in the bacterium, there is a step of viral genome synthesis and protein. So the protein will be synthesized, all these protein, and the genome will replicate, genome of bacteria. Then there will be an initial phase of assembly. So assembly means the head, tail fibers get together to make the phage, the complete phage. And after this complete phage, then the bacterium will just be lysed, will be destroyed. And by destroying this bacteria, the viruses will just get out, release the first direct production of an enzyme that damage the bacteria cell, allowing for it to enter. The cell burst, releasing 100 to 200 phage particles. So, and they keep infecting the new bacteria that they can quickly clean the plate of bacteria in the media. So the lytic phase, you can go through this. I think this is more interesting, and it allows to understand how this bacteriophage really gets their DNA inside the host cell, host bacteria. And from this DNA, everything will be synthesized from this, either protein, either replication, and by replicating, we lead to assembly, then release, then infect new bacteria or infect new bacteria continuously, and bacteria will just be. And this is an example of lytic bacterium. A question? A question?
Question.
Yes.
Yes, as you have seen that there are some viruses which have the genetic material in form of RNA, and then mostly we know that the host cell they have the genetic material in form of DNA, and then I want to ask you, here on lytic replication cycle, I've seen that after the viruses release their genome into the cytoplasm, the host cytoplasm, you see that its DNA they incorporate in DNA of the host cell. Then I wanted to ask how the RNA genome for those viruses we have, which have genetic materials in the form of RNA, are going to incorporate in DNA of host cell. I wanted to ask how.
What is your name, please?
My name is Nyirigira Theogene.
Theogene, I don't hear clearly your question. Do you mean for RNA virus, how does they manage to integrate their DNA, their genetic material into the host cell? What do you mean?
Yes, I mean, I want to mean that how RNA viruses are going to incorporate their genetic material into the genetic material of the host cell so that the replication can continue as well.
So one thing that you have to know is that only few viruses will integrate their genome in the host cell genome. And those are called RNA viruses. Those are called retroviruses. So they have to change their RNA into DNA. That is the case of HIV. Then the DNA from the viruses will then be integrated in the chromosome of the host cell. Otherwise, it can't integrate RNA in DNA. So it have this enzyme, reverse transcriptase, that change the RNA into DNA, and this DNA will be integrated in the genome of. Otherwise, RNA viruses does not need to integrate in the DNA of the host cell. They can easily replicate in the cytoplasm. Do you follow? So they replicate in the cytoplasm of the host cell without need of integrating to the host cell genomic material. Only retroviruses need to change their genetic material and integrate this genetic material to the host cell genome and initiate replication. Do you follow?
Yes.
Only
Yes.
retroviruses, and this is a small class. The rest of RNA viruses, we only replicate in the cytoplasm. We never get in the genome of the host cell.
Yeah, thank you.
So in animal cell, how does the viruses replicate? It follow the same basic replication pathway as a bacteriophage, but there are some differences. One is that presence of envelope around some viruses. We have said that when there is an envelope, then the bacteria, the viruses have to exit from the host cell before it dies. What happens if the virus is enveloped, but the host cell, they die before the release of viruses? What do you think will happen? Children, what do you think if enveloped viruses lead to death of the host cell before release?
What I think about that, when the host cell died before release of that virus, I think once the cell dies, there is the release of the enzyme that will destroy that cell membrane, so that the content inside they may be outside.
So thank you, Theogene. Anyone else can explain what do you think will happen in case the host cell die before releasing the enveloped viruses being replicated in that cell? Niba host cell ipfuye zitaraba released, murumva byagenda gute? Ninde wadusobanurira wundi? Who can explain that? Basically, in that case, the virus will not be active, will not have this envelope, a complete envelope, and will not be infective, will not be able to infect any other host cell. Why? Because it loses this envelope. It will not acquire the envelope. To acquire the envelope, the host cell have to be live, have to really give this part of its envelope to the virus. In such way, this envelope will allows this virus to infect other viruses, because this will have the receptor. We have the molecule that we bind to receptor. Otherwise, without that, the virus will not be infective. Will just be incomplete. Thus, not able to infect other cells. So another difference is that the nature of animal cells, which is karyotic, a bit different from the bacterial cell. There is also lack of cell wall in animal. So all this we make the replication to be a bit different from the bacteria we have seen. So in animal cells, there is attachment. The virus will attach to the cell membrane, protein and the glycoprotein. Then there is a penetration. The penetration is either by endostosis or fission. When we say endostosis, we see that most NEC viruses we get in by endostosis. Means the bacteria, the virus will be just internalized in the way the cell, the host cell, used to get the material from outside. And the fusion means the membrane, the envelope of the virus and the cell membrane will fuse. And by fusing, we allow the capsid, nucleocapsid, to get in. Uncoating by mostly viral enzyme, but also sometimes host cell enzyme. The enzyme in the cytoplasm can allow the hydrolysis or uncoating of or removing the capsid. Then after the capsid is removed, the nucleic acid is released. There we start the biosynthesis. We have seen that there is R protein, there is late protein, but there is also replication of genetic material in nucleus, mostly DNA viruses, or in cytoplasm for RNA viruses. Then there is maturation. Nucleic acid and capsid assemble, so they get together. Then after it's complete, mature, then it can be released. In most cases, for enveloped viruses, by budding. So the host cell does not die, but secretes the viral particles. Or by rupture, that means the cell die and release all viral particles inside. There is for animal cell replication, there is attachment of animal viruses. In most cases, there is chemical attraction of viruses to their receptor. So the animal viruses do not have the tails, all tail fibers, as you have seen for T4 phage. They don't have that tail that allows ejecting the nucleic acid in the host cell. Rather, they have to either get in or bind. They have glycoprotein spike or other attachment molecule that mediates attachment to the host cell. Synthesis of virus in animal cell may require different strategy depending on its nucleic acid. For example, DNA viruses often replicate in nucleus, while RNA viruses will just replicate in cytoplasm. Must consider how messenger RNA is sensitized. We have seen that some viruses are positive polarity, negative polarity for the RNA. Some we have this retro or reverse transcriptase. So we see how each virus is produce its messenger RNA. And messenger RNA here means protein. What serves as template for nucleic acid replication. So sometimes what serves for nucleic acid replication is totally different from the original nucleic acid of in case of hepatitis B, we have seen that although it is a double-strand DNA, it have these RNA steps. It have a transcriptase that we first make the RNA step before changing to DNA, before it generates DNA for new viral particle. So how does the virus get in? We said there is two strategy. There is fission, which is mostly done by envelope viruses. So the membrane, the envelope of the viruses fuse with the membrane of the host cell. By fusing, it will allow the nucleocapsid, which is inside here, to get in. This is example paramyxoviruses, herpesviruses, but most we just get in like this. Some others will, although they have this, they will be getting by endostosis, although they have this envelope, but the envelope cannot fuse with the membrane, the cell membrane, but the cell membrane can make the internalize this by endostosis, means they make the internalization of viruses by making invagination of the membrane. Then the phagosome of the internal virus is just internalized in a phagosome, and this phagosome all together, the envelope of the virus and the outer phagosome will just be digested to release the nucleocapsid, which the nucleocapsid also have to be released to make uncoating, to get the nucleic acid outside. So these are example: influenza virus, Toga viruses, and rhabdoviruses. And these are mostly digested by endosome. Then there is a Pinocytosis, viropexis. This means the virus doesn't have the envelope, that is fast, and it just getting as how the foods or the other nutrient gets in the host cell. So then the coat or the capsid will just be released by digestive and endosome. After the digestive endosome, then the virus will just be released, and uncoating this will either require the enzyme, the virus enzyme, or the cytoplasmic enzyme of the host cell. And this is the case of polio, adenovirus, and retroviruses. All non-enveloped viruses, necked viruses, will just get in by pinocytosis or viropexis, or viruses with a membrane mostly get in either by fission, fission from without, and or by endostosis. So, or for necked viruses, there will be viropexis or pinocytosis. Any question on this?
Yes, Prof. What is the difference between endocytosis and pinocytosis in this case?
Anyone who can explain? Anyone who can explain? Endostosis, Pinocytosis.
Endocytosis is the engulfing food particle, while pinocytosis is the fluid.
Wabyumvise?
Not yet.
So the non-enveloped is in form of fluid, is together with fluid. Yes, the endostosis is more solid, like how the solid material gets in the cell. Who responded? Who was that?
Pacific.
Mugabe?
Yes.
Yeah, so that is correct. Pinocytosis or viropexis is kind of ingesting the fluids in the cell, while here it's a solid component. If it envelope, so it have to be ingested as a solid material inside. While here it's just liquid. Just liquid gets in the host cell. So the method here, the pinocytosis, is more the fluid. So the soluble substances. So these are kind of soluble. They are very small. That is one, and they are in fluid-like. And this one will be more endostosis is biphagostosis. It's like solid material getting in. You can read more about that.
One more question. For this endocytosis, one example of influenza virus, you said some tagoviruses. So what the remaining tagoviruses and lactoviruses, what do they do apart from endocytosis?
What?
You said some tagoviruses, where you are putting your cursor. Some tagoviruses, lactoviruses. So they use endocytosis. So what are other pathogenesis do?
What do they do?
Yeah, because maybe it is some, which means what some part of the part of
some will be able. These are family of viruses, and within family there is a species, and some of the species will be able to fuse to make this way of getting internalized. They can fuse with the cell membrane. Some other species we do the endostosis. So it means in rhabdoviruses is the causative of rage. So some of the species in here are able to fuse. Some others will not be able to fuse. We just be phagostosed or internalized by endostosis.
Yes, thank you.
And that depends on the nature of that species. If it can't fuse, then it have to get internalized in this way. But influenza viruses is always is always getting in by endostosis, although it have this membrane. But only if some, not all, togaviruses, rhabdoviruses species, tuzabona the species in here and the pathogen in here, which are able to internalize by this way or the other way around.
Yes, thank you.
Question.
Yes.
You say that enveloped viruses get into the host cell by fusion, and naked viruses get into the host cell by endocytosis. What are the type of viruses that get into the host cell by pinocytosis?
Anyone can answer the question of Christy? Christy, all viruses
But no,
which
ikigaragara cyo
Viruses.
ikigaragara cyo nuza virus zikoresha pinocytosis ni virus ziri
hello, we don't hear you well. So all naked
ikigaragara
viruses,
ni uko yeah.
all naked viruses, we never make the fusion. We never do endostosis. We always get in by pinocytosis or viropexis. All enveloped viruses, we always do either fusion or endostosis. Christy, is that clear? These two are for enveloped viruses, and this one is unique for non-enveloped viruses or naked viruses. We say naked because it doesn't have this envelope. Is that clear? Clear?
Yes.
No?
Yes.
Question.
A question?
Yes. How do digestive endosome produced, and what's the function of for them?
What?
How do digestive endosomes produced, and what's the function of them?
Yeah, normally this way the viruses get in is the way the normal cells get nutrients in. Sibyo? Iserire ibigomba kubona nutrient from outside its environment. Sibyo? So by getting the nutrients, some are solid, some others are in fluid, are soluble. And those which are in here or in here have to get out, have to be released in cytoplasm. So these digestive endosomes are always in cytoplasm. These are enzymes that allows the cell to hydrolyze this outside or this phagosome to release the contents, which is nutrient, which is, in this case, it is not nutrient, it is virus. So it will release as it was nutrient, but then its content is not nutrient. Is that clear? Normally, the digestive endosome are always in the cytoplasm. And these are there to allow releasing the content of the phagosome coming outside. And by digesting this membrane, then the viruses will be released. will be released, not in favor of virus release, but normally it's there for nutrition or the normal function of the cell. Is that clear?
Yes.
Digestive endosome are just lytic enzyme inside the cytoplasm. And some of the enzyme, we even allow digestion of the protein that coats or protect the nucleic acid. Some viruses have the specific coat, the specific capsid, which cannot be digested by cytoplasmic enzyme of the cell. And in that case, this virus have to carry its own enzyme that have to digest its coat. Otherwise, it will remain gelled within the capsid and without releasing the nucleic acid. Idasohotsemo ntabwo virus ya replicating. So viruses does not do binary fission. These have to get out and synthesis have to be done. And the synthesis is about making more component of viruses and assembly of this virus components, then mature release. So the same as we previously see, there is always receptor that allows the viruses to attach on the cytoplasmic membrane of the host cell. Then some, like we have seen for viruses, like the one we have seen of T4, the phage, we just eject the nucleic acid. This is more for bacteria, but for the animal cell, the viruses we're getting after touching the envelope can match, the viral envelope can match with the cell membrane and release the nucleocapsid. And the nucleocapsid can then be uncoated. The lytic enzyme in the cytoplasm or the enzyme from the viruses can destroy this coat, this protein coat, the capsid, and release the nucleic acid. And this is the membrane fission that we just explained. Then we have endostosis, which is the normal way that the cell gets food inside. So the viruses just, of course, have to be enveloped viruses. Then after attaching, then the envelope, the cytoplasmic membrane of host engulf the viruses and cytosis. Then it will release the phagosome inside, and this phagosome will be digested by the cytoplasmic enzyme, then release the nucleocapsid. Then the nucleocapsid will be cleaved by the enzyme again in cytoplasm or from the viruses, and that is uncoating. As long as this is not out from the coat, the replication cannot start. And this is what we said, this is the early phase of replication. Then the late phase starts with the macromolecule synthesis, the assembly, then the release. That is the second phase. So there is a lot to visualize, like viral envelopes, match, fusion of what, then they can get in, capsid released into cytoplasm, then so you can see all this to explain how it works. how do they get outside? Once the viral capsid is ready, it will just go to the outer membrane and then buds, bourgeonner. So by budding, it will create this envelope, and this is mostly from the host membrane. Of course, there is component of the viruses like glycoprotein, but the lipid membrane is typically from the host, the lipid membrane. And without this lipid membrane, these viruses cannot be able to infect a new cell. It has to get outside with this lipid membrane, which have this receptor binding protein. Idasohokanye n'iyi membrane ntabwo yazashobora kuinfectinga in the host cell. So it have to get in this way. And if the cell is or die when the virus is not yet at the stage of having its envelope, then the viruses also will be inactive, will not be able to infect any other host cell. So this is similar, nothing new. We have the virus attached, we get internalized, we release the genomic material, then the replication, then the assembly, then the release of the viruses from the host cell, infected host cell. Same as we said, all to facilitate your understanding on how it works. And mode of single-strand RNA viruses replication, we have an example of positive polarity, positive strand genome like polio, like this phage. By getting inside with positive, there will be RE protein synthesis. RE protein synthesis will quickly be done because this is already a messenger RNA kind of, and the RE protein will allow then the replication of this more in more copies. And then late phase protein, which will be mostly structural protein, by having the progeny virion nucleic acid, also protein, then the assembly can take place. For negative polarity, we have always an RNA-dependent RNA polymerase, which have to go with them. Here, this copy is able to generate this enzyme. It doesn't have necessarily to go with RNA-dependent RNA polymerase because it is a messenger RNA able to automatically translate the message to synthesize the protein that it needs to replicate. It's really important to know this. Positive polarity are the same configuration as messenger RNA, and it will automatically lead to synthesis of RE protein, which is enzyme mostly, and this enzyme will allow synthesis of negative strand, and from this negative strand, niho hazava is positive strands. Kuku is complementary. They are complementary to negative strand, not to this one. So it have to go through this, and it have to first get this enzyme, which is an important enzyme for replication. Whereas negative polarity viruses like influenza, we always carry its own RNA-dependent RNA polymerase, Without this, this can be useless because this one cannot be translated into protein in the cell unless you have the polymerase. And once it is translated, you have the more copy of positive. In positive polarity, we make more protein synthesis, structural protein synthesis. But also from this positive polarity or messenger RNA, there will be copies, more copies of genomic material of this virus, which are required for new viral particles. And this is the one to be incorporated in the virus together with something like this. Is this clear? This is typical for the two categories, for positive polarity and for negative polarity. Some particularities may come depending on the virus. Arikibazo? If no question, we have this double strand. This is who classified the viruses by this feature. Who did we say did this classification of viruses? Baltimore classification of viruses, where we have double-strand DNA, we have single-strand DNA, which have two. Then positive polarity DNA, negative polarity DNA, we have double-strand RNA, we have RNA retroviruses, and you have DNA retro. And this is a class of HIV, this is a class of hepatitis B virus. And so location of virus replication in eukaryotic cell, virus genome, depending on the configuration, they may replicate in cytoplasm or in nucleus. Double-strand DNA, some are able to do their replication in cytoplasm, some others in nucleus. In cytoplasm, that is the case of smallpox, but majority of double-strand DNA we replicate in nucleus. That is the case of herpes viruses. Single-strand DNA, we always require the nucleus. Why? They need the enzyme in nucleus to replicate their genome. Double-strand RNA will always be in cytoplasm, single polarity, positive polarity in cytoplasm, and all negative polarity, non-segmented genome in cytoplasm, but segmented genome, RNA segmented genome, we all replicate in nucleus. And don't ask me why. Sometimes they require some component within the nucleus to replicate. Some other time, this is the nature of the viruses. So retroviruses, that is positive polarity, this is HIV. We make single-strand RNA to double-strand RNA within cytoplasm, and double-strand RNA will migrate to nucleus and integrate in the genome of the host cell. After integration, copies of RNA, single-strand RNA, which will be incorporated in the virus, will be just synthesized from the nucleus after integration. And this is a typical example for retroviruses, how they do. And the pararetroviruses, which are also double-strand DNA, we go through the RNA step and sometimes integrate, and then produce RNA, which in turn will be exchanged to DNA before incorporation in the viruses. Is this clear? this is just what we explained since start. Class 1, double strand, they immediately produce messenger RNA in host genome, as the host genome does. Class 2, have to make complementary in the transcription into messenger RNA. Class 3 and 7, in which viral polymerase or other special viral enzymes are often required to replicate the viruses. This is the schematic presentation of class 1. Class 2, where it have to really first make the double strand. For double strand RNA, same. We mostly replicate in the cytoplasm. We never require to get in the nucleus. Here, single strand DNA can only replicate within nucleus. In class 4, single strands positive polarity sense RNA, this is kind of polio. We only replicate in cytoplasm. And it always goes without any enzyme. Replicase, no replicase. While negative polarity, negative sense, we strand, we always carry its, I think here, it have to always carry its replicase to be able to produce protein. So I think we all discuss this clearly. This is mostly for positive sense single-strand RNA, which automatically generate proteins and proteins, which allows complementary single-strand RNA synthesis and more copy of this one, then assembly. With negative polarity, we have this. It always have to be with RNA-dependent RNA transcriptase, which allow complementary strand to be synthesized, which also serve as a template for more copies of genomic or viral genomic material, and allows more virus to be synthesized. In case of double-strand RNA, will be unwinding, then positive sense serve for protein synthesis. This one serve for more replication and so on, assembly, and generate more viruses from the one virus that gets in. So as viral replication, we just have to consider the genome configuration and how is messenger RNA is synthesized. And this is a kind of saying how does this virus produce protein, and what molecule is template for genome replication. How does the genome replicate? What does the virus has in its own capsid? What makes the nucleocapsid? So we have assembly, maturation. So always once the viruses has made proteins, made, yes?
Can you repeat what template mean?
Who can explain template? Who can explain what does mean template? Here.
I think the template is something we take ni ikintu dukora ku kindi, aho tuvana ikintu. Tuvuga niba turi gukora DNA, turi gukora replication, dufite strand kugira ngo dukore indi component isa nkaho yuzuza iyo tuzayikuraho. Ikintu twakuyeho cya kintu tuzita template.
You are correct, and I thought this was clear from the beginning. Otherwise, yeah, and template means you have your genomic material. Sibyo? Genomic material ishobora kuba ari RNA cyangwa ari RNA positive polarity cyangwa RNA negative polarity. So, how does these viruses synthesize that genomic material to get in the viruses? It's hard to get template. For example, here you have the viruses that have negative polarity RNA. Ni ukuvuga muri viruses izi nizo ziba zirimo, ntabwo haba harimo positive polarity. Ariko kugira ngo ukore izi nyinshi, iyi izaba template yo gukora positive polarity. Iyi will serve as template for synthesize this one. And then from this one, which will be a template for synthesizing more of this will be the template for neo template tuvuga hano for genome replication. So for genome replication, we need positive single-strand RNA to serve as template to make more of this. And more of these are needed because you need more viruses from this cell. Similar to this one, the positive polarity is the one to be in the virus. Ntabwo virus z'ubwoko bumwe zishobora kugira positive single strand RNA ngo zigire na izindi zigire single strand RNA. So some of this, if it happen, then it will be inactive. It will not be able to serve as function, although it can't be possible. So this one we cannot serve for more of this one. We serve a template for this one, and this will be the template yo gukora copies nyinshi zo kujya muri viruses. Iyi negative polarity. Although this can be automatically be translated into protein, and this protein, one of them is the polymerase that allows complementary synthesis of complementary strand, and this complementary strand will be the base or the template for making more copy of this. Igisubizo baguhaye nicyo. Ariko template ni ukuvuga ngo this is a template to get this, but this will be the template to get more of this, and this will be the one to incorporate in this virus. As we do here, this will be the one to incorporate in this virus, and this here will be the one to incorporate in this virus. So, in brief, what serve for making these viruses? This will be the template. The positive single-strand RNA will serve as a template to make more of this, the genome that will be incorporated in this virus. Is that clear? So the assembly process involves the collection of all the components necessary for the formation of the mature virus. So it's just to get together everything, the protein which was synthesized here, the nucleic acid, all together to make the complete viruses. And these have to take place at a particular site in the cell, not everywhere. They have to be really strategic. During assembly, the basic structure of the viruses, particle is formed. Basic structure is formed, as you can see. The site of assembly depends on the site of replication within the cell and on the mechanism by which the virus is eventually released from the cell. So if the cell or the viruses have to be released from the cell by cell death, then the site can be all over within the cell, and we interfere with the normal function of the cell, leading to the death of the cell and release of. But if it is enveloped viruses, for example, it has to be strategic and close. The maturation will be closer to the membrane. In such way, the release can easily be done by budding, as you have previously said. So the budding, we make the virus gets out, but also infect other viruses. Maybe host cell ipfuye hakirimo some of viruses that are not yet getting this structure. The virus will not be able to infect any cell and will just be inactive. So you can compare in bacterial cell versus in human viruses. Attachment protein on tail attached to the protein on the cell wall. We don't have cell wall. So spikes, which are glycoprotein on the virus capsid, or envelope protein attached to the protein or glycoprotein of the cell membrane. So instead of tails, we have the spike on our viruses that attach, or capsid attach, envelope attach on the protein of the cell membrane. Genome is injected into the cell or diffused into the cell. So here, there is no entry of capsid. In animal cell, the capsid just get in. Direct penetration, fission, or endostosis. Direct penetration, here we say, is more of pinocytosis. Uncoating, there is no uncoating in here because the DNA is the one to be ejected in. Here, it have to be uncoated, removal of capsid by cell enzyme. Here, the capsid remain outside. It doesn't get in the bacteria. Site of synthesis is mostly cytoplasm, RNA viruses in cytoplasm, but most DNA in nucleus. Site of assembly in cytoplasm, RNA viruses in cytoplasm, most DNA in nucleus. Mechanism of release, most or always by lysis. It have to be lytic. It have to destroy the host cell. Here we have seen that naked viruses we mostly get out by lysis, but some can get out by exostosis. Exostosis is the mechanism of excreting viruses. But enveloped viruses we always bud. Without budding, they cannot be able to infect other host cells. Nature of chronic infection. Infected cell can stay always incorporated into host chromosome, may leave host chromosome. Here it's more latency with or without incorporation into host DNA. And incorporation is kind of permanent. While here it can leave the host. So in brief, viruses replicate in three broad strategies: initiation of infection, replication and expression of the genome, release of mature viruses from the infected cell. So this is the brief on how most viruses replicate. How do they grow or get in a huge number? So this is how, in summary, most viruses replicate, but we see each viruses have its particular way of replicating. Any questions so far? Arikibazo?
Yes, Prof. I want to know when there are two viruses that are attacking one cell, what criteria will be used to select the virus that will enter in that cell?
No, I don't get you. When
there are two viruses that are attacking
same kind of viruses, or
yes, same kind that are attacking the same cell.
Yes.
I want to know which criteria will be used to select the virus which will enter in that cell.
The criteria for virus which
will enter in that cell.
I don't get your question. Do you mean yeah?
Yes, nyine ndashaka kubaza nimba ari nka virus ebyiri zatatse cell imwe niyizinjira muri izo zombi, they are of the same kind. Niye rero icyo gihe izinjira ngo ijye muri iyo cell.
So if two viruses are attached on the same host cell, yeah, sometimes they get in both, but some other time, if one of the two viruses gets in, we inhibit the cell. We be like able to never get inside other viruses. So it's like it will know that there is a viruses get in, and we protect its new viruses to get in. Urabyumva? Ni ukuvuga ngo birashoboka ko zombi zakwinjira muri cell. They can get in. So hari ufite ikibazo, hari ndabona hands. So the virus can get both inside the cell, but if one comes to get in before, then the viruses, the other viruses will not be able to get in. Wabyumvise cyangwa tubisubire?
Byumvikane prof.
Ni ukuvuga ngo kenshi na kenshi zishobora kwinjira nta criteria ihari, zombi ziba ziri able kwinjira nk'uko zakwatakinga kuri cell membrane, ariko iyo imwe yinjiye cyangwa iyo cell already reinfected will not allow other new viruses to infect the same cell. So maybe let's go through this quickly before we take a break. This is the most important. How do viruses cause disease? And how do the human response fight to not get sick? So there is two antagonists. The virus cause disease, but the immune response protect the host. But also we see that the host immune response can be the base of the pathology that is linked with viruses. Viruses cause disease after, first of all, break through the natural protective barrier. So they have to get in. They have to cross this natural protection. The skin, the mucous membrane, all those are the barriers. They have to evade immune control. They have to be able to escape, kill a cell of an important tissue, or trigger a destructive immune and inflammatory response. So they cause disease by either killing the cells of important tissue, or the immune response, inflammatory response that was induced by the viruses can then destroy this tissue, important tissue. So that is the two way. The virus destroying the cells, downward step, virus is immune response, inflammatory response generated by the infection at the virus induce destruction. So majority of viruses are subclinical, and will be cleared out of the host without any problem. And as you see, viruses it's not their interest to harm or kill the host. Kubera ko twabonye ko zitafite independent life, so they don't have interest in killing the host cell. Thus, majority of viral infection are subclinical and can be easily cleaned from the host. However, the outcome, what happened next, depends on two important elements. One is the interaction between the virus and the host cell, virus-host interaction. The second is the host response to the infection. Because this response sometimes cannot only destroy the virus, it will always destroy the host cells that contain the virus, and this response can then be harmful than the virus itself. So there are some factors to consider in viral pathogenesis. So there is serial pathogenesis, that is the effect of virus on the cell, how the viruses get inside the cell. We also have to consider the cause of infection, primary replication, systemic spread, secondary replication. Mostly primary replication takes place in the site of entry, where the virus is, or close to the site of entry. Then after the initial replication, the viruses can gain systemic or bloodstream, then can reach the target cell or the target tissue or the susceptible tissue, then replicate over there, and that is the secondary replication. We have to consider the cell or tissue tropism. We have to consider the damage that they will cause over there, and the host immune response. As we said, sometimes or in most cases, the host immune response is the one that destroys more than the virus itself. Sometimes the viruses can be cleaned out completely. Some other time viruses can persist, can just remain within the host cell. As entry, we have to consider our barrier, our primary barrier, which is skin. And skin is protective, most protective, but of course its integrity is important to act as effective barrier. When there is abrasion, cuts, many viruses can get in because of this. And sometimes there is vectors like ticks, mosquitoes that breach the skin barrier to inject the viruses in. Otherwise, skin is a solid barrier to most viruses. So we have mucous membrane, like conjunctiva and other mucous membrane. And this is conjunctiva is a very exposed site, relatively unprotected. So relatively unprotected, see, once a virus gains the conjunctiva membrane, then it is easily possible to infect or to succeed to infect the host. We have respiratory tract. And respiratory tract, in contrast to the skin, the respiratory have this mucosal surface, which have sophisticated immune defense mechanism, like inhibitory mechanism, ciliated epithelium, mucus secretion, lower temperature in the higher respiratory tract. And the viruses to cause infection have to overcome all these mechanism, protective mechanism. And this serve as barrier for many viruses. Of course, some will be able to overcome this. This is the case of the current coronavirus, the COVID-19, or other respiratory viruses. Some are able to cross or to overcome all these challenges. We have gastrointestinal tract, a hostile environment. We have the gastric acid, bile salt. Some viruses are able to cross this environment, like polio. We cause problem after crossing the gastrointestinal tract, and they are always resistant to all this acid, gastric acid, or bile salt. Genitourinary tract, they are relatively less hostile, and they are not well protected. Although the exposure, it is not exposed to external environment. So external viruses cannot easily gain this route, except exposure by their hosts. Genitourinary tract, you have to really take the pathogen to that area, let's say during the sexual intercourse and so on. Otherwise, from the extraneous viruses, they can't easily gain the genitourinary tract. So we have, as we said, cause of viral infection, we have primary replication. And this primary replication mostly takes place where the viruses get enter into the host. So closer to the place of entry, the virus will first replicate. Zigire replication kugira ngo zibe nyinshi. And this is frequently determine whether the infection will be localized at the site of entry or spread to become a systemic infection. So when this replication takes place, then in a way that is uncontrolled, the viruses will be able to escape the area and gain the systemic, the bloodstream mostly, and it will gain the other sites. It will spread via the blood to all other sites or other tissue, including the central nervous system. As secondary replication, this will take place at susceptible organ, tissue, following the systemic spread. So, you disseminated to other organ, the susceptible organ will then initiate or the host Sorry. So we have these 3 steps: primary replication, which mostly takes place at the site of entry. We have systemic spread. We have secondary replication, which takes place in susceptible internal organ tissue, following the spread of the virus. As outcome of viral infection, once successful, it can be acute infection or chronic infection. So acute infection recover with no residue effect. There is nothing else. It's completely cured. And some can lead to permanent scaling. So this is the case of acute viral encephalitis leading to neurological scale, meaning the virus is no longer there, but the damage that caused remain permanent. Sometimes this acute infection leads to death and may proceed to chronic infection. So it can start with acute, then it proceeds to chronic infection. And chronic infection is silent subclinical infection for life. So once it's introduced, then it remains over there for life. Sometimes a long silent period before disease. This is the case of HIV. It can cause disease, but not now. It can take sometimes. Reactivation to cause acute disease. Sometimes it can reactivate. It's there, silent. Then, depending on the factors, such as immunosuppression and others, it reactivates and cause disease, cause acute disease. And sometimes chronic disease can have relapses, exacerbation, like case of hepatitis B virus, hepatitis C viruses, mostly linked with immune responses. Sometimes chronic infection lead to cancers. We know some viruses that are linked, well established with cancers. And that is the case of both hepatitis C, B. We have Epstein-Barr viruses, human T lymphotropic viruses type 1, human herpes virus 8. So all these viruses have been linked with specific cancers. So these are the possible outcome of viral infection, but in most cases, there is a recovery with no residual effects. But of course, sometimes permanent infection with reactivation or disease after long period of silence, or sometimes causing cancer or inducing cancer. Same here, showing the same things. Acute infection like rhinoviruses, the common cold, rotaviruses, influenza viruses. This will just be acute and finish without any problem. Some can just be persistent until death. Some others have this reactivation cycles, like herpes. They can reactivate and cause disease. Some others are in clinically latent forms, like HIV, or measles. They can just remain silent for longer periods until the patient dies. So the cause of typical acute infection, once the viruses get in, establish infection, that means it have already overcome the physical barrier, the innate immune defense. We have the physical barrier, we have innate immune defense. Then it starts replication at the site of entry, or close the site of entry. By replicating, it will increase in number in such way that at one level, it will get to a threshold level that activates adaptive immune response. And by activating the adaptive immune response, then the immune response or the specific immune response comes in play. Then the viruses keep increasing depending on the duration, the viral growth, until the adaptive immune response is its highest to really take care of the viruses and eliminate the viruses. The viruses can be cleared, and the memory or the memory or the protective state of the host will be generated. So once adaptive response comes in, there will be some level of memory. If this is not activated sufficiently, then the memory will be less. Sometimes the memory can be lost, but in most cases with viral infection, we have memory that protects against same viral infection. Specifically, some memory we react with a wide cross range of variant. Some other memory we just cross-react with the variant that induced their release or their. So host defense against viral infection. Immune response to virus probably has the greatest impact on the outcome of infection. So it's like the immune response for viruses is all, sometimes major pathological role is induced by immune response. Viruses themselves, they don't cause problem as such, but huge inflammatory response induce destruction of tissue, then the disease will just be the cause of that immune overreaction of immune response. In most cases, the viruses is cleared, as we said, and completely clean from the body and result in recovery, complete recovery. But some other times the infection is unable to be cleared. The viruses persist, stay in. And the cellular immunity play a major role in cleaning the viruses from the host. Whereas immune or antibody immunity, that is lymphocyte B response, protect against reinfection. So when that is the memory is mostly for protection against, while cleaning what is already established is more of cellular immunity. I think we have immunology course and you will be able to distinguish or understand both components. So I think we can take a break, 15-minute break, before we continue with the next slides. Can we meet at 11:15? Is that okay with you?
Okay. Okay.
So we meet at 11:15. So we meet at 11:15.
hakozwe najya gukora attendance rero bibike imbere mama inkoze yantesheje umutwe kurabura n'itunguye
I think let's resume our slides. Host defense against viruses employs the normal protective of the human defense. There is natural barrier, which is skin, mucous membrane, as we have seen. We have non-specific immune defense, like fever, which we interfere the replication of viruses, interferon, macrophages, natural killer cells, and we have antigen-specific immune response that we said this is then adaptive response, which is more specific to the pathogen. We have in both antibody and cellular immune response, and both are really important to antiviral immunity or to clean the viruses. Hello, are you back? Can you hear me? Hello? Murahari?
Yes.
Friends?
Very good.
Are you there?
Okay.
Can you hear me?
Okay.
Murahari? Hello? So, interferon is released by, of course, the immune cell, like macrophages, block local viral replication and initiate the antiviral state in surrounding cells. So once it is known that a virus, an external agent, is within the tissue, then the interferon will be able to block local viral replication or also initiate antiviral states in surrounding cells. So there is natural killer cells. All these are natural innate immune system. And natural killer cells, we just directly kill all infected cells. And if it's enveloped viruses, as we said, if the cell is killed, then the viruses cannot infect the host because this virus will be non-infective as they lose this the membrane that allow them to attach on the host cell. We have macrophages that also engulf the viral particles, but also present the viral particles to the CD4 or T helper cell T, and the CD8, which then we generate adaptive response to the viruses. We have T cells, we have T4 cell or CD4 cell, which is the chief of the coordinates everything of the immune response against viruses. And you have CD8 lymphocytes that destroy infected cells. I think you will learn more once you have the immunology course, but you can already know this is especially interferon, natural killer cells, macrophages are part of innate. They are not adaptive. Then with the T cell, we are then in adaptive response, which is specific to this virus. And not only T cell, the B cell also will be informed about the invasion, and antibodies will be initiated. the antibody response. The cell-mediated immunity is required for lysis of target cell and will be effective for non-cytolytic infection. So this non-cytolytic infection we always lead to the activation of immune response. Will be exacerbating the alerting the inflammatory response, and the inflammatory response will then destroy the tissue. This is the case of hepatitis viruses A, B, C. They don't kill the hepatocytes by themselves. No. They only infect the cell and produce or replicate in there, but release the antigen that will lead to immune response activation, and killing of infected cell will be more due to immune response. Noneho za mara kwica nuze tissues nini, then the symptoms start appearing. So antibodies neutralize extracellular viruses. They can't get in the host cell. So antibodies are important to neutralize extracellular viruses and may be sufficient to control lytic viruses. So if the viruses is more leading to lysis of the host cell, then the antibodies can neutralize all viruses outside the cell. Once the cell is killed, then they will not infect new cell, thus eliminate or block viral replication by themselves as antibodies. However, if the viruses is non-cytolytic, then it will require cell-mediated immunity kugira ngo ishobore kudestroyinga za cells ziri infected. Otherwise, they will be the source of continuous excretion of viruses in infecting more and more tissue. So, as you said, some viruses may persist, and usually represent a secondary event, not primarily on the site of entry. Following on initial acute infection, hakazaho persistent infection, and are not usually significant cause of acute illness. In case a virus have this persistent infection, kenshi na kenshi nta acute illness there. And they can be important for these 5 reasons. They can enable infectious agents to persist in the community. So in such way, abantu bamwe bayifite ntibarwaye, ntiwabatandukanya n'abatayifite, so they will be the source of a continuous source infection. They can be activated in immune suppressive patients. Some are associated with immunopathological diseases, some even with neoplasm cancers. Some are immunosuppressive by themselves, like HIV. And we allow problem from other harmless persistent microorganisms. So with HIV, each of the viruses which is harmless comes in. So by definition, all those viruses which tend to have persistent infection cannot, by definition, lead to acute lethal phase. They normally don't induce lethal or death of the host, as they need to be sustained in that host. They tend to cause mild tissue damage or disease in the host. They don't really cause a big problem as acute. There is 2 types. One we can differentiate, but normally not easy to differentiate. We have chronic viral infection, and you have latent viral infection. In latent viral infection, the viral genome in the host is not replicating. There is no replication. While in chronic, there is some low replication happening, and is characterized by shedding of the virus for prolonged time. And most like rubella, cytomegaloviruses, or hepatitis B, V viruses will continuously be excreted. Zagumamo, zaguma aho ngaho, replication taking place, while in latent viral infection like HIV case, there will be like maintenance of the viral genome in host cell without clear replication. This is the case of herpes viruses, retroviruses. The genome of viruses is just integrated in the genomic material of the host cell without replicating. And once replicated, then when then the evidence of disease is then notified. That is the case of reactivation. We produce subsequent cytopathogenicity or alteration of cell cycle, leading to neoplasm in case of herpes viruses, or AIDS in case of retroviruses, which infect the immune cell. So by destroying the immune cell, the CD4 cell, but also macrophage, so they gain reducing suppression of immune response, thus allowing other viruses to. So sometimes it is difficult to distinguish or make the clear distinction between chronic versus latent infection, as sometimes HIV can be in latent, but also chronic. Latent viral infection, but chronic. How? Once integrated in the bacteria, the host genome, it can be quiet. It can be like nothing is there, no replication, nothing. But it can also be reactivated and start replicating its genome, thus leading to chronic viral status and shedding the viruses in blood easily. So some viruses causing persistent infection must be able to evade the host immune and a mechanism to attenuate their virulence. Why? Because without the way of evading the host immune, the viruses should be cleared out quickly. So then it have to really have a way of evading, but also attenuate their virulence, because when their virulence is high, or the way of causing disease is high, then it will be acute, or it will kill the host fast. It will then not be persistent as chronic or latent. And there are some preferred sites for persistent infection, that is neurons, central nervous system, which is less accessible to immune system. And this is the case of human simplex, herpes simplex viruses, Varicella zoster viruses, measles, and so on. Liver, lymphocyte or monocyte, so they can be even in the immune cell, like HIV, HTLV. Central nervous system can be a preferred site for this, for persistent viral infection, because it is not readily accessible to immune system. So they are just hidden from the immune system. So with persistent infection, we mean failure to eliminate completely the microbe. So we have a number of viruses here which are characterized by persistence. We have herpes simplex viruses which persist in those root ganglia, neurons. They are not infectious in this condition. They can be activated and produce cortisol, and the viruses can shed to exterior during this reactivation. And we have Bacillus zoster virus, the cause of shingle, also same location, not infectious by then. It can be activated and cause shingle or zoster, and it can then be shed to exterior. We have cytomegaloviruses in lymphocyte tissue, Epstein-Barr viruses in lymphoid, but epithelium, but also salivary gland. This is, and within epithelium, it can be infectious, nasopharyngeal tumor. We have hepatitis B in liver. It sheds in blood, and even in this chronic status or persistent, it's always infectious. We have polyoma viruses, Burkitt, which shed in kidney. We have measles in brain, causing the SSP. We have HIV, which shed or have its persistent in lymphocyte macrophages, causing chronic disease, always infectious. So how do they achieve this level of persistence? They have mechanism, as we said, to really be able to persist. They don't do that by random. Huh? Otherwise, all viruses would prefer that. So they have strategy that evolve to bypass or overcome host defense. One is tolerance. They have to develop the tolerance. Some others use immunosuppression in the case of HIV. Some others we do antiphagocytic strategy. Others we miss suitable target for the immune system, mopping up antibodies, like mopping. They clean antibodies by soluble agent antigen. We see that with hepatitis B, for example. Interference with the immune response, immune force. Sometimes they can do antigenic variation, so they don't remain with the same antigen. They can reduce interferon induction or responsiveness, microbial presence in accessible sites. So they just go in brain, they go in bone marrow where the immune response will not really reach. Invade the immune system to evade the immune system. They can destroy the immune system themselves, like HIV. So with tolerance, there is like a lack of responsiveness. So the host defense does not really produce the response to the, and this is likely because of molecular mimicry. So meaning the antigen of the viruses looks like a host antigen. So immune response to this antigen is weak. So they don't produce antibodies or response because they see as the host antigen. Sometimes immunosuppression. Hosts show depressed immune response to antigen and related to those infective organisms. Why? Because of suppressing, let's say, the HIV case, which attack both CD4 and macrophages, will result in loss of immune reactivity. So by infecting the immune system itself. So they can adapt to the encounter with the macrophage cell. So microorganisms, as we said, they are first exposed to the phagocyte, and the microorganisms which attract are ingested, so they can be killed by the phagocyte. In this case, this will be eliminated without any problem. So only those successful evolved to some degree to avoid phagocyte by interfering with the antimicrobial activity of the phagocyte will cause disease. And most viruses do not infect phagocyte, but the following viruses can also multiply within the phagocyte. Entry via endocytosis or fission, not phagostosis. So the phagocytes are behaving like other cells, other host cell, tissue cell, and the virus can just get in and replicate inside the macrophages by killing them, as we end up with immunosuppression. So normally, this is what happened. The macrophages or the phagocyte, we phagocyte or engulf, internalize the microbe in phagosome, and this phagosome is merged with lysosome, which are more antimicrobial agents inside here, enzyme and reactive chemicals. And once it's matched with the lysosome, then the microorganism inside here will be killed and digested. Will be killed and digested. So this is the normal way phagocytes kill or neutralize the microorganism. So there is also a number of strategies that microorganism uses to prevent the effect of phagocytes. Sometimes they can inhibit production of phagocytes, not well established, not very well known. They can inhibit inflammation. By inhibiting inflammation, then the macrophages remain in vessels. They don't go in tissue where the pathogen or the microorganism are. They can inhibit chemotaxis. The microorganism can inhibit the transfer of phagocyte from the vessel to the tissue, infected tissue. They can also kill the phagocyte, the phagocyte. They can inhibit phagostosis. Ari nabyo bibaho cyane kwica phagocyte no gukora inhibition ya phagostosis zikiniba ya effect ya engulfing. They can inhibit lysosomal fission nubwo zagezemo imbere ariko zikanga phagosome ntibe matched na phagosome, which is here, is not able to match with the lysosome. Then the bacteria will just remain inside without being killed. They can resist killing and multiplying in phagocyte. So they can also allow this to match, but they resist to what is the content of the lysosome. In that case, then they can replicate or multiply and kill this. And this is general for bacteria as well as viruses. So there is absence of suitable target for immune response. Sometimes there is no really the target for suitable for immune response to destroy the viruses or to mount a correct immune response. And sometimes the viruses can spread direct cell to cell. They don't get outside the cell. They just spread from one cell to another without getting outside. So then this is an example of herpes simplex viruses, which we prevent neutralizing by antibody by just infecting the neighbor cells. And some enveloped viruses like corona, flaviviruses avoid displaying antigen on the cell surface by budding into cytoplasmic vesicles. And the virion released via fission of vesicles and plasma membrane, which is a really extraordinary phenomenon. And by doing that, then the antigen will not be shown. So the infected cell cannot be recognized, cannot be killed. Sometimes antibodies are mocked up by soluble protein from the pathogen. This is the case of hepatitis B. Hepatitis B is producing surface antigen. Nyinshi is a surface antigen neutralizing antibody up to this titer. In such way, they neutralize all antibodies in the host. So the antibodies then, which were due to neutralize viruses, will only be neutralized by surface antigen. And the virus can keep infecting other tissue or cells, hepatocytes. So sometimes there is local interference with the immune force. So all these are the way the viruses will be able to manage their persistent or their chronic or latent states. Some can make antigenic variation. Like in case of influenza, which is well known, antigenic shift, antigenic drift, we see this. How does it work? And by changing the antigenic structure, then the immune response mounted against the initial antigen will not be effective for the next antigens. And some viruses can induce or reduce interferon induction. So they can induce or interfere with interferon induction, leading to non-function of the interferon. Kandi twabonye ko interferon ari blocking virus from infecting other cells. Also blocking replication of viruses. This is the case of vaccinia. This is smallpox viruses, which secrete soluble receptor which bind and inactivate interferon. So it secretes soluble receptor, zihura na interferon, zikaineutralizing. Same as adenoviruses are insensitive to interferon. And the hepatitis B viruses, which are poor inducer of interferon. So by poor inducing the interferon, then the interferon will not have place to play in case of hepatitis B virus. Then we have microbial presence inside inaccessible to the immune response. we say that a question.
Yeah, may you pick the point number 8? I've not understood it well.
What?
I've not understood the point number 8.
Reduced interferon induction. So that means a virus is there, but it doesn't stimulate the production of interferon. Interferon is released by mostly by macrophages, which then block replication of viruses or just alert the neighboring cells that there is an infection. Then the neighboring cells can then mount the antiviral state. So hii interferon itari induced cyangwa itaba produced, like in case of hepatitis B, then the susceptible host will not be alerted of antiviral state. The antiviral state will, or also the blocking of interferon on replication of will not take place. Nukuvuga interferon ni imwe muri cytokine y'ingenzi muri immune system ya viruses. So interferon igira function yo kublockinga replication ya viruses no kwalatinga the neighboring cells ko hari infective agents zigaproducinga or zikalimitinga infection. So some viruses we reduce interferon induction. We not allow, we have this property of not inducing the interferon response. Cyangwa interferon ikaba ihari ariko ntikore nk'uko igomba gukora. For urugero, in case of smallpox virus, is secretinga soluble receptors zibindinga interferon zika inactive. Nibi secretinze, then the interferon which was made to neutralize or to block the replication will be neutralized by the secretion of smallpox viruses. Is that clear? No? Abyumvise? Ni ukuvuga interferon ni cytokine, ni imwe muzabibona y'ingenzi muri viral immune response. So sometimes the pathogen, the viruses are located in area which is inaccessible to the immune response. Let's say in brain, in neurons. So many viruses can just persist over there as there is no access. There is no such good access to the. Let's see, some can be, it is difficult T cell and antibodies to reach the limit and eliminate the infection. If the viruses can be shed or can be located in the lumen of salivary gland, for example, mammary gland or kidney tubule, this will be really far from being reached by T cell or antibodies. Some can invade the immune system and evade the immune system by invading them. All this one, including the HIV, can infect the immune cells. And by infecting the immune cell, they can manage to evade the immune system. And all these can infect, as we see, lymphocytes, macrophages, lymphocyte macrophages and lymphocyte macrophages, meaning that they are then attacking or they are reproducing, replicating in the immune response cells. So by then they will induce immune suppression, but also evade from the other immune cell, kubera ko ziri muri immune cell by themselves. As summary, viral pathogenesis depends on the complex interplay of a large number of viral and host factors. Nukuvuga ngo not only viral factors, but also host factors as the immune response, as we said. Viral factors include cell tropism and cellular pathogenesis. So that means how the cell are susceptible and what mechanism does the viruses use to induce disease. The immune response is the most important host factor as to determine whether the virus is cleared or not. Bivuze ko immune system ariyo ishobora guclearinga viruses. So there is non-specific immune defense. Once it penetrates, it crosses the natural barrier. And this non-specific immune, we attempt to limit and control the local viral replication and spread. So izagerageza kubikuraho, sometimes to manage, some other time to fail. And when to fail, there will be antigen-specific immune response. Here twavuze ngo ni adaptive immune response, which is specific defense, and will be the last to be activated and generally systemic. So will not be local, will be all over, cell-mediated and antibody-mediated. The immune response in the host, in most cases, the only and sufficient mean of controlling a viral infection. So na kuma viruses menshi muzasanga nta miti yindi ihari uretse umubiri kwirwanaho kaba ya clearinga and control viral infection. So that is what is more viral pathogenesis. Any question on this?
Excuse me, lecture.
Dakumva James.
What's the difference between cytolytic viruses and non-cytolytic?
Can answer James. James is asking what is the difference between cytolytic and non-cytolytic viruses. Ninde wadusubiriza James?
Repeat question.
No one can answer?
I think the cytolytic virus, the virus that attacks the cell and then finally it is released enzyme to release the host cell, and then non-cytolytic virus are the virus that attack the cell, and then finally they give other viruses by budding.
Is it clear, James? So some viruses will lead to death of the cell, the infected cell. Only to get out, they have to kill this cell. And that is generally the naked viruses, the viruses that have no envelope. They will kill the cell to get out of the cell. Huh? And that is the lytic replication or the lytic viruses. And the case of all enveloped viruses is that they have to exit the host cell with the lipid membrane. And the lipid membrane is only from the host cell. The virus are not able to produce that membrane, that lipid membrane. And if they have to take that lipid membrane, then it has to get out by budding, and that is non-lytic replication. So meaning that they will leave the cell intact. The cell will be excreting viruses, but remain live. James, is that clear? I think your colleague has answered well. James, is that clear?
Yes, thank you.
So before we break, maybe we can take a few minutes to go through these few slides. Viral disease and epidemiology about viruses. So the relative susceptibility of a person and severity of the disease depends mainly on factors such as the nature of exposure, how the exposure was made, the immune status of the host, the age, general health of the person, the viral dose, and the genetic of the viruses and the host. So a new variant or viral strain would cause a viral outbreak. Turaishi turugero rwa SARS-CoV-2, the agent of COVID-19. Ngira ngo mujya mubibona iyo haje new variant ko hahita haba pike, habaho increase in number, because even those with the initial infection with original viruses can be infected by the variant, the new variant. Acute hepatitis is more symptomatic in adulthood than in children. So this is the susceptibility, the age. And the infants can be prone to more serious of paramyxoviruses or gastroenteritis, whereas adults cannot be, of course, with rotaviruses.